Why do I snore? You've been told you snore. Maybe your partner nudges you awake at night. Maybe you've woken yourself up. Or maybe you're exhausted every morning and you're not quite sure why. Snoring is one of the most common sleep complaints we hear at Grace Sleep Clinic. And it's also one of the most misunderstood. Most people assume it's harmless, a bit embarrassing, maybe, something to joke about. But in clinical sleep medicine, snoring tells us something important about what's happening in your body while you sleep. In this video, we're going to walk you through exactly why snoring happens, what it might mean for your health, and crucially, when it's time to get it properly assessed. Let's start from the beginning. When you fall asleep, the muscles in your throat naturally relax. As air flows in and out through your airway, if there's any narrowing, any reduction in space, that airflow becomes turbulent rather than smooth. That turbulence causes the soft tissues in your throat to vibrate, the soft palate, the uvula, the base of the tongue, the walls of the pharynx. And that vibration, that's the sound of snoring. It can range from a gentle rumble to something loud enough to wake everyone in the house. Now, the key question isn't just what is snoring, it's why it's happening in your airway specifically, because the cause varies from person to person, and that matters enormously for how it should be addressed. There are several reasons why some people are more prone to snoring than others. Anatomy plays a big role. If you have a naturally narrow airway, a long or thick soft palate, enlarged tonsils, or a jaw that sits slightly further back than average, all of these can reduce the space available for airflow during sleep. Muscle tone is another factor. In deeper stages of sleep, and particularly during REM sleep, the muscles throughout your airway relax significantly. In some people, this allows partial airway collapse or vibration, especially if the airway is already a little narrow. Sleep position matters too. Sleeping on your back allows gravity to pull the tongue and soft palate backwards, further narrowing the airway. Many people find their snoring improves simply by switching to sleeping on their side. And then there's genetics, craniofacial structure, airway dimensions, and fat distribution patterns are often inherited, which is why snoring frequently runs in families. None of this means snoring is inevitable or untreatable, but understanding your particular anatomy and physiology is the first step to addressing it properly. Snoring is far more common than most people realize. Around 30 to 40% of adults snore regularly. Among men and women over 60, that figure rises to as high as 60% in men and 40% in women. Snoring prevalence increases with age, and there are several reasons for that. As we get older, airway muscle tone naturally decreases. Connective tissue loses some of its elasticity. Fat distribution often shifts, including around the neck and upper airway. And for women specifically, the menopause brings significant changes. Reduced estrogen and progesterone levels affect respiratory control and airway muscle stability, which is why many women who never snored in their younger years begin snoring in midlife or later. Weight also has a powerful influence. Increased fat tissue around the neck and throat narrows the airway and makes it more collapsible. For many individuals, weight optimization alone can produce meaningful improvement in snoring. Here's where we want to be honest with you, because this is the part that often gets overlooked. Occasional mild snoring during a cold after a glass of wine or when you're particularly exhausted is generally benign, but habitual, loud snoring is a different matter. A significant proportion of habitual snorers, potentially 40 to 60% of those over 50, may have some degree of undiagnosed obstructive sleep apnea. That's a condition in which the airway partially or fully collapses during sleep, causing breathing to stop momentarily, repeatedly throughout the night. Sleep apnea is associated with elevated blood pressure, increased cardiovascular risk, metabolic dysfunction, impaired cognitive performance, and mood disturbance. In more severe cases, it's linked with raised risk of stroke, heart disease, and type 2 diabetes. It also affects safety. Unrefreshing sleep and daytime sleepiness are among the most common consequences, and that has real implications for driving and concentration at work. We want to be clear, we're not saying snoring always means something serious, But we are saying it deserves proper attention, not just acceptance. You should seek a clinical assessment if your snoring is loud and habitual, if you've been told you stop breathing in your sleep, if you feel unrefreshed or excessively sleepy during the day, or if it's worsening over time. And it's not only about the person who snores. Snoring is one of the most common reasons couples come to see us. Partners experience fragmented sleep, insomnia symptoms, and the strain that chronic sleep deprivation places on any relationship. Addressing snoring can have significant relational and psychological benefit, not just for you, but for the people you share your life with. If you do seek specialist assessment, here's what that typically involves: an overnight sleep study, which can often be done at home, evaluates your breathing patterns, oxygen levels, heart rate variability, and sleep quality indicators. This helps identify whether sleep apnea is present and how significant it is. An upper airway examination may involve assessment by an ENT specialist or dental sleep medicine practitioner, looking at nasal airflow, jaw and dental alignment, and the structural characteristics of your airway. At Grace Sleep Clinic, we take a multidisciplinary approach. Our team includes specialist sleep physicians, ENT surgeons, dental sleep medicine practitioners, and lifestyle and metabolic health experts, working together to understand the full picture before recommending any treatment. Treatment depends entirely on the underlying cause, which is why accurate assessment matters so much. Lifestyle and behavioral measures are often the first step. Weight optimization, reducing evening alcohol, addressing nasal congestion, managing reflux, and positional sleep strategies can all make a meaningful difference. Mandibular advancement devices are custom dental appliances that reposition the lower jaw slightly forward during sleep, enlarging the airway and reducing tissue vibration. These are particularly effective for mild to moderate sleep disordered breathing. CPAP therapy, continuous positive airway pressure, is the most effective treatment for moderate to severe obstructive sleep apnea. It works by delivering a gentle, continuous flow of air that keeps the airway open throughout the night. Positional therapy, using devices or techniques that encourage side sleeping, can be helpful for those whose snoring is primarily position related. And in some cases, surgical intervention may be appropriate, particularly where there is a clearly defined anatomical issue, such as significant nasal obstruction. However, surgery is generally considered after careful specialist evaluation, and outcomes vary depending on the individual. The right treatment for you will depend on the results of your assessment, which is precisely why a one size fits all approach rarely works. Snoring is incredibly common, but common doesn't always mean harmless. For some people, it's a simple anatomical quirk. For others, it's a signal that sleep quality and breathing are being compromised in ways that affect health, energy, and safety. The most important thing is to take it seriously enough to find out which category you're in. At Grace Sleep Clinic, we offer comprehensive sleep assessments, bringing together the clinical expertise to understand your snoring in full and the treatment options to address it precisely. If you'd like to learn more or book a consultation, visit gracesleep.clinic. The link is in the description below. And if you found this video helpful, please do share it, because there are a lot of people out there who've been told snoring is just something they have to live with. It doesn't have to be. We'll see you in the next one.